I'm Bill Good, and welcome to those of you joining us this morning on the Chorus Radio Network. Dr. James Helliwell, president of the BC Anesthesiologist Society, announced his resignation this morning on this program. He says when he initially took on the role, his goal was to come up with cooperative solutions that would benefit patients, the healthcare system, and its providers. But he says he hasn't seen any of that during his term. In fact, he says he has never even managed to have a meeting with Health Minister Mike de Jong about his concerns, including the shortage of anesthesiologists in BC.
I'm stepping away just incredibly frustrated with how the system is. Everybody talks about how the system is broken. We know that in the last decade, the healthcare system has gone from an $8 billion to a $17 billion investment by the taxpayer. Yet we know that the wait list was 74,000 people a decade ago and remains that today. That's 74,000 people waiting for surgery. For the last 2.5 years, I and my colleagues in anesthesiology, despite the fact that we have a crisis in our own profession, viewing that crisis instead of just sort of asking for more to do the same thing, what we've said is, let's change the system, let's make it better. And we've been trying to dialogue with government and to find a reasonable solution to be able to deliver better value to the taxpayer and cut down on that wait list.
Health Minister Mike de Jong is unavailable this morning. We tried to contact him. He's out of the country. We hope to be able to talk with him tomorrow. In the meantime, Mike Farnworth is the NDP health critic, and he joins me on the line this morning. Mr. Farnworth, good morning.
Good morning.
Your reaction to Dr. Helliwell?
Well, I think it's really unfortunate because I think it says something about the state of relations between anesthesiologists and the government in the province of BC, that the head of the organization has felt that he's had no choice but to step down, and I think that's really says something, and and what it says is not good.
So what needs to be done?
Well, I think there's a number of things that need to be done. First off, I think the government needs to treat the concerns of the anesthesiologists seriously. They need to sit down with them. The fact that Dr. Helliwell is not able to meet with the Minister of Health, I think, is shocking. I think the government needs to recognize that this province has a shortage of anesthesiologists. We're one of only 3 provinces that over the last 10 years has not been able to decrease the vacancy rate in terms of the number of anesthesiologists that we need. We've canceled, last year, more than 283 surgeries at Surrey Memorial, slates of surgeries because of a lack of anesthesiologists. But perhaps, I think, in my mind, most disturbing of all is that BC is the only province in Canada that doesn't meet the national standard of dedicated obstetrical anesthesiologists at the Level 3 maternity hospital. So that's Surrey Memorial, VGH, which is Victoria General, and Royal Columbian. And so clearly there's a problem, and it's not being addressed. And the fact that the head of the association has resigned in frustration says the government's not taking it seriously, and that's got to change.
Dr. Helliwell says that they've published peer-reviewed papers showing that we could make system changes to increase OR productivity by up to 56%, allowing more surgeries to be performed within even limited resources. If the government worked with the anesthesiologists, he says they could get the surgeons operating more, make better use of the billions spent on perioperative care in BC, and most importantly, deliver better and timelier care to tens of thousands of suffering British Columbians.
And that's exactly the approach the government should be taking. I mean, we have a great healthcare system, but it has lots of challenges. And the best way to meet those challenges is by working with the very people who deliver healthcare on that day-to-day basis and who know where the problems are and who are working in terms of, okay, maybe if we make a change here, we can do some improvements over there. It's the people at the front line who are actually delivering it, whether it's anesthesiologists, whether it's healthcare workers. They're the ones who have solutions and ideas. What it needs is for the government to sit down and work with them and the government to listen, and that's not taking place.
I find it very sad and troubling to see somebody he's a young man. He's an extremely talented young man. I know his services are in demand. When I talked to him a year or two ago, he was being shopped by other provinces to try to get him to move and leave British Columbia. He's still determined to stay here and try to make the system work better from within. but it's frustrating to hear his frustrations.
And that's what's so concerning, because he's a young doctor, a young specialist. We need Dr. Helliwell and others like him in the province of BC. There's only around 300 anesthesiologists in this province. I think more than half of them are over the age of 50, and over the next 10 years, many of them, if not most of them, are probably going to be retiring. We've been trying to recruit anesthesiologists from other provinces without success, because other provinces don't have the same issues that we do in terms of keeping people, in terms of keeping anesthesiologists. Other provinces work with the association, not in British Columbia. And that's why we have a shortage. That's why we're the only province that doesn't meet national standards when it comes to obstetric anesthesiologists. And until government takes the issues that the anesthesiologists are raising seriously and sits down and works with them, the system and the situation is not going to get any better.
Mike Farnworth, thank you.
My pleasure.
Mike Farnworth, NDP Health Critic.